is Stephen Throne. I live in Visalia, California. I turned 65 earlier this year. For, as long as I can remember, for a long, long time, I've always felt bad. Went to doctors, couldn't tell what was happening. Years ago, I even ended up going to one of those doctors that was like an AIDS doctor kind of guy. That just, and he said he didn't know anything about me. Why was I there to see him? So off and on, mostly all I've ever gotten is high blood pressure and that kind of thing results. So I've been going and taking all kinds of different barium tests and everything else. But in 2003, I got hurt at work, and I haven't worked since Thanksgiving of that year. And one thing kept leading to another. I got hurt, and then I got a stomach bleed from Celebrex and had that fixed, and I ended up hypokalemic after that, and with lots of back pain, and just seemed like it started going downhill after that. The pain and everything else just kept going and going and going. And then, probably for a long time, anytime the weather changed, I get joint pain and that kind of stuff, and I just write it up to, joint pain just from the weather. But about 3 years ago, I started getting real regular joint pain, and then about 2 years ago, it started being real bad, and I switched different meds. I was on methadone, and then I was on OxyContin, and none of them seemed to touch the pain when it got really, really bad. So we've always been like my wife and I both looked into holistic medications and that kind of stuff, and then different alternatives like acupuncture and that, all that kind of thing. And George Loeb's wife worked with my wife and mentioned that George had got some really good success up here with Dr.Nezami with an alternative treatment. And my wife and I are always into that kind of thing, and it doesn't matter for us about insurance stuff. It matters if you're moving forward and getting better. That's the key. If you're getting better, if you're feeling better, then something's working good. And if you're not, then you're just taking a bunch of pills that's just either suppressing your system or doing something else to it. So we called and had a Skype consultation with Dr. Nezami from my house, and that was in late June. The next Monday, I was up here and signed in, and it went through 10 consecutive IVs and hyperbaric chambers, and before that, I'd gone to see a rheumatologist, and told them I was taking antibiotics, and they seemed to help with the pain. And when I stopped taking the antibiotics, the pain came back in all my joints, not just my hands, but my toes, my knees, my feet, my back, just everywhere, my neck, and he said, well, maybe I had an infection somewhere, because I took 7 vials of blood, and he said I didn't have lupus, and I didn't have rheumatoid arthritis, and I didn't have this, I didn't have that, but I must have an infection somewhere, and the antibiotics were helping. But he didn't find it, so I'm scheduled to 6 months to go back later, and so I'm going to see him again in another week or two. But, so I came up here, told Dr. Nezami what was going on. They started my blood tests, and I asked him one day that I'd been reading up on all the different autoimmune diseases, and of which like 4 or 5 of them were for women, so I didn't have to worry about those. But the rest of them might have applied, and started reading up on Lyme disease. And I asked him to do some Lyme disease tests, and I came up with Lyme disease, like long time or chronic Lyme disease and current Lyme disease. So I started continuing to up the antibiotics, and Dr. Nezami changed my IV medications. And I started feeling better, and I started feeling better. The color came back to my face, and I was a happier camper, and the pain was a lot less to deal with. And so just here about a week and a half or 2 weeks, a week ago, we took another blood test, and I've come back negative for Lyme. I've got the antibiotics now, and the anti-whatevers for Lyme disease in my blood, but I don't have Lyme disease anymore. So I'm going to start stopping the antibiotic and see how that does, and continue with the IVs and the treatment for another few weeks, just to make sure that everything's settled in and copacetic. But man, I'm feeling a lot better. I'm a happy camper, and I can't say enough. These guys helped me when I didn't know what to do, and I didn't know where to go. And my wife and I thought, hey, what the heck, let's give it a shot. So I was up here the first few weeks doing it. My wife was in Phoenix at a conference, so I was on my own, and met everybody up here, and they're all nice people, and they treat you well. IVs don't hurt when you get them, they don't hurt when they take them out. You know, it's a wonderful place. I can't say enough. I really appreciate everybody here, and I want to thank you all a lot. And again, if you need to talk to me about it, or somebody needs to talk to me about it, you've got my phone number. Tell them to give me a call. Love you guys, appreciate it. I want to thank you a lot. Really do.